Hi, my name is Cleo Montanera and the topic of my video is Attention Deficit Hyperactive Disorders in Children and Adolescents. Definition. ADHD is the most widely studied mental disorder affecting children from age 4 to adolescence years. Parents today have many questions about what they can do for their child dealing with ADHD. Children with ADHD may be hyperactive and unable to control their impulse, or they may have trouble paying attention. These behaviors interfere with social and home life.
Adrian, how are you? How you doing? Give me 5.
School is becoming a struggle for first grader Adrian, who is easily distracted.
He's really active. He doesn't stay still.
You get lots of homework, Adrian?
Yes.
Yeah? How many pages?
15.
He's unable to complete the homework.
Yes, and he doesn't stay still. He just gets distracted easily.
Pediatrician Blanca Fresno of Children's Physicians Medical Group says children who have attention deficit hyperactivity disorder, or ADHD, are more likely to have learning difficulties, but can succeed in school with the right support and treatment.
ADHD is a condition that affects the child in such a way that he or she is not able to control their behavior. It affects them in their everyday life, it affects them in their school performance, and in their relationships.
The 3 main symptoms of ADHD are inattention, hyperactivity, and impulsivity.
When the symptoms start affecting all the areas and things become out of control, pretty much you need to seek an evaluation. We're going to check his vision and his hearing, and I'm going to give you some questionnaires for you to fill out. And the teacher needs to fill those out as well. We test them for their vision and their hearing, and then we provide the family with a questionnaire. These are standardized questionnaires, and they are supposed to be answered by the parents and by the teachers. And when they come back and follow up, we score these questionnaires, and those scores give us the risk for the patient.
A detailed family history is important because often there is a close relative with the disorder.
ADHD is seen in the family. Often we find out that it's in the father or a cousin or an uncle, sometimes in the mother.
If we decide that Adrian does have ADHD, what would be the process?
There are 3 different ways to approach treatment, through the school, through counseling, and through medical treatment.
The use of prescribed stimulant medications in the treatment of ADHD continues to be strongly debated. However, many pediatricians say in most cases these medications work well in controlling symptoms of hyperactivity, impulsivity, and help improve focus.
These medications have been out in use for so long. We do know that the outcome in children who use medications is better than those children that don't use medication.
Dr. Fresno likes to show parents this before and after example of how medication improved a young child's focus in his schoolwork.
You can see how focused the work is here and how chaotic is there.
Academic support can range from tutoring, preferential seating, extended time on tests, and even using electronic teaching methods such as tablets. Dr. Fresno says it's important for both parents and children to learn ways to cope with ADHD.
Empowering these children with knowledge, giving them enough counseling to find out that there's absolutely nothing wrong with them. That's simply how they are and how they live in the world. And giving them the right guidance to succeed prevents so much of the complications of low self-esteem.
For more information on ADHD and other children's health topics, call 877-276-4543 or visit cpmgsandiego.com.
Application in medicine. Children with ADHD are often able to concentrate on activities they enjoy. But no matter how hard they try, they have trouble maintaining focus when the task at hand is boring or repetitive. Children with ADHD are unable to sit still, stay quiet, or pay attention. They may appear disobedient, but that doesn't mean they are acting out on purpose. ADHD often continues into adulthood. So don't wait for your child to outgrow the problem. Treatment can help your child learn to manage and minimize the symptoms. Medication that may not be the best answer. Education, behavior therapy, support at home, and school exercise and prepared nutrition.
Hi, Dr. Winter.
Hi, Allie.
I've been hearing a lot over the past few years about ADHD. So, what is that really?
ADHD stands for Attention Deficit Hyperactivity Disorder. So what we really see are problems with inattention, hyperactivity, and impulsivity. We don't find any physical problems per se.
How can you differentiate between normal misbehavior in children and ADHD?
The child with ADHD is that 1 in 20 who is squirming in a seat or getting up out of a seat when he's expected to stay in it. Or it could even be a child who doesn't have a hyperactive component, what we used to call ADD. That's a child who actually doesn't have any problems with behavior. He or she just sort of flies under the radar. And so what happens is, unfortunately, years can go by when the child is just not performing up to their potential. Diagnosis is with a psychiatric evaluation. We get input from the parents, from teachers, from babysitters. Collateral sources are very, very useful in that evaluation as well.
So, how do you treat ADHD?
Therapy is helpful for treatment. Changing the child's environment, if we can, is helpful. We work with the parents. They need to be educated, directed, supported. We work together with the teacher, the child psychiatrist, and the child. It's not a job for the child alone. And then finally, medication could be quite helpful.
What are the long-term effects of medication on the brain, if there are any?
To date, there are no known long-term side effects. There are studies that show that children with ADHD who go untreated have a higher likelihood of engaging in criminal activity in adolescence. So that association is there. It's not there for the ADHD kids who do get treatment.
So once you go on medication, does that kind of mean you're on it for life?
Treatment is a day by day, week by week, month by month thing. It's not, somebody's either on something or they're off something. We change things accordingly, and we work with the realities at the moment.
It can be reevaluated over time.
Constantly, absolutely. What we find is, as children get older, the hyperactive component of ADHD improves substantially. The inattentive part may or may not, it depends.
It kind of seems like nowadays we're seeing many more cases of ADHD than we ever used to. Why is that?
I think that we don't really have a very good comparison because we didn't recognize ADHD then like we do today. I think people are just more aware and astute. And what's nice is that today we really have wonderful treatments for ADHD. It can make a huge difference in a child's life. And what it comes down to is all those years in school, all those years of potential don't have to go to waste anymore.
Thank you. This puts a whole new perspective on things.
Okay, thank you, Allie.
Pros. The stage of life cycle will be most prominent in will be the early childhood state, age birth to 8 years of age. This disorder all starts when the child is at the age of kindergarten, typically 4 years old. Between 3 and 5 years of age, children continue to grow rapidly and begin to develop fine motor skills. By age 5, most children demonstrate fairly good controls of pencils, crayons, and scissors. Gross motor accomplishments may include the ability to speak and balance on one foot. Cons. P. Psychical. They may be very psychical or aggressive. They may react angrily or inappropriately when they are upset. They may have trouble cooperating with friends. Intellectually. Since children with ADHD have a tough time adjusting in class or can't concentrate on one item or subject for a long time. Social. Child, child psychologists have believed for years that children with ADHD are about 3 years behind their peers in social development. Emotional. They may have difficulty reading social cues. For example, they may interrupt or have trouble taking turns. Issues apply in Ecuador. 5% of infants have ADHD and it affects the boys more. According to the Diagnostic Manual of Mental Disorders of American Psychiatric Associations, in Ecuador, the Minister of Education registered 7,918 boys with disorders in public establishments.
I took medication when I was a kid. Everyone said I would outgrow it, so I stopped taking the medication in college. Everything is so hard now.
I hate math. It's so boring. I know I'm bad at it, even though my teacher says I'm not.
I'm a failure. I can't remember to do homework. I lose things. I can't get anything right.
I hate feeling like I'm different, but I really am. Work seems like it's easy for everyone else.
These are the voices of people with attention deficit hyperactivity disorder, or ADHD. Millions of American children, teenagers, and adults experience this disorder, which makes it hard to concentrate, pay attention, organize, and focus. Their lives are complicated because of it. I know. One of these voices is mine. I was diagnosed with ADHD when I was 9. Most kids with ADHD start to struggle with symptoms even earlier than that. I first noticed my symptoms in school when we began doing projects that took planning, and I got frustrated a lot. Later in middle school, I was on the basketball team, but I was always late to practice. Eventually, my teacher called my parents to talk about my grades, since I understood the material, but didn't turn things in on time. At that point, my parents, my coach, and my teacher all compared how things were going. And that's when my parents took me to see my pediatrician. ADHD can show up in 3 different types: inattentive, hyperactive impulsive, and combined. My symptoms were more of the inattentive type. I was having a lot of trouble losing things or forgetting things, not finishing homework, and organizing my work for projects and future assignments. My parents told me at first that they wondered if I had a hearing problem, because sometimes I would look like I didn't hear them when they talked to me. Other children also struggle to keep their attention in class, can look super distracted at home and school, and have trouble with details for things they're not interested in. Kids with more hyperactive or impulsive symptoms have trouble waiting for their turn. They might get up from their seats in class, run around when it's not a good time to do that, talk all the time, interrupt people, or blurt out answers. A lot of times, kids with ADHD can get into trouble, since the symptoms can look like they don't care or aren't respectful of others. But they do care. They just can't control it because of their problem with attention. While some people might have inattentive type and others have hyperactive impulsive type ADHD, still others might have symptoms of both, which is called combined type. If people show 6 symptoms from either of the first 2 types, or a combination of them adding to 6, they fit the diagnosis. While ADHD is most commonly diagnosed in kids, almost all of them continue to experience it as teenagers, and a majority still have symptoms as adults. Only some people grow out of it. The most important thing to know is that treatment for ADHD works. For little kids, this is behavior therapy that also includes their parents, so the whole family can be part of the solution. For school-aged kids and older, the best choice is medication or a combination of medication and therapy. I had behavior therapy where I learned some skills, like specific time management and organization techniques, that helped me in school and in my sport. I also took a stimulant medication that helped me focus my attention. Sometimes people find great help in non-stimulant medications, especially younger kids. For most people, ADHD medications really help focus and block out distractions. ADHD is a serious challenge for kids, teenagers, and adults who struggle to pay attention and focus in many parts of their lives. But there is hope. Treatment works. School wasn't easy for me, but with my therapy and medication, I learned what I needed to do to make it work. People go on to do well in school and succeed in their lives and careers, in spite of and because of their ADHD. I know. I did.
0.918 boys with disorders in public establishments. In conclusion, ADHD in children is a disorder that affects the community not in a bad way, but does affect more of the adults in the community, such as the teachers and the parents of the children who had ADHD. The parents who had ADHD children are affected emotionally and psychically, running around from doctor to doctor and hospital visits could be hard for the parents. Sometimes they feel drained and tired. Emotionally, parents could be worried for their child and wonder how they will make it through life. The teachers in the community have some difficulty on how to deal with children with ADHD.
How to recognize ADHD symptoms in children. Is your child high-spirited and unfocused or suffering from attention deficit hyperactivity disorder? These ADHD guidelines will help you decide if a checkup is in order. You will need an analysis of their behavior, an idea of how long it's been going on, and a visit to the pediatrician. Step 1. Note their capacity for concentrating. Most young children have short attention spans, but those with ADHD don't seem to be listening even when they're spoken to. They frequently lose things, have difficulty following instructions, and often make careless mistakes. Step 2. Recognize if their energy level seems excessive, even for a child. Are they unable to sit without fidgeting? Do they get in trouble at school for leaving their seat, or running and climbing excessively or inappropriately? Do they talk incessantly? Interrupt constantly? Some children are more inattentive than hyperactive, and vice versa. Girls are more likely to have more attention problems, while boys more often fall into the hyperactive category. Step 3. Consider how long the behavior has been going on. If you've observed symptoms for more than 6 months, it might be ADHD. Step 4. Note where the behavior takes place. If it's only at home or only at school, something other than ADHD may be to blame for their symptoms. Step 5. Gauge the seriousness of the problem. Children with ADHD are regularly disruptive at school and at home. Their behavior causes problems in their relationships with both adults and other children. Step 6. If you recognize any of these symptoms in your child, take them to your pediatrician. It's important that they have a medical checkup to rule out other causes for their behavior before ADHD is diagnosed. Did you know children whose mothers had smoked while pregnant were more than twice as likely to have ADHD as children whose mothers did not smoke?